Not sure if your child might be experiencing anxiety? On today's episode, let's talk about some common symptoms of anxiety in young children and ways to help them.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Welcome back to Be Kind Pediatrics. My name is Dr. Blair Rolnick. I'm a board-certified pediatrician and mom myself. And today I want to talk about recognizing anxiety in young kids, like elementary school kids. What are some signs? What are some common causes? And most importantly, how can we help our kids? So as a pediatrician, I commonly hear from my parents about the fact that their children have worries or fears or reluctance about things, especially things like going to school. And I want to say off the bat, anxiety is a normal part of growing up. But when it starts to affect daily life, like our ability to go to school or our ability to engage in things that we enjoy or form friendships, then it's an important time to take a closer look. So let's explore how to recognize early signs of anxiety in school-age children and how parents can help. So one of the reasons I want to talk about this topic today is anxiety can actually look a lot different in children than it looks like in adults. Children have a much harder time verbalizing that they are worried and sometimes show other either physical symptoms or behavioral symptoms compared to adults. So let's talk about some of the emotional signs. So excessive worrying about school or friends or family, frequent fears of things like, very afraid of the dark or frequently afraid of the dark, frequently afraid of getting sick, frequently afraid of being away from their parents or family. Irritability, clinginess, sudden mood changes. I don't think that it's very obvious to a lot of parents that when their child is really moody or super angry or doesn't want to leave them, that maybe that's actually because they're feeling anxiety. And then avoiding social situations, especially school-related activities. Children tend to be a little bit different in adults in that they tend to have more physical symptoms of anxiety. So they tend to have things like stomach aches, headaches, with no clear medical cause. So always, stomach aches and headaches should be examined and evaluated by a pediatrician to make sure that there is not something causing them stomach pain or headaches. But after a thorough evaluation and there is no medical cause, we really should also consider potential anxiety. Fatigue and trouble sleeping are another common symptoms in children of anxiety. And again, this should be thoroughly evaluated by your pediatrician to make sure that there is not some cause for their fatigue or difficulty sleeping with things like potentially like a sleep study or checking their iron, making sure there's no other additional contributing factors. But we should also consider the possibility that maybe that there is something causing them to have poor sleep, like frequent nightmares or difficulty falling asleep from worry or concern. Lastly, fast heart rate, sweating, shortness of breath. These are concerning symptoms in a child and again should be evaluated to make sure there's nothing else going on from a cardiac or pulmonary standpoint, but also are common symptoms of anxiety. And so after a thorough examination and workup, we should consider anxiety as a possible cause for repetitive symptoms in children of these signs and symptoms. Behavioral signs. So refusing to go to school, refusing to participate in the activities that you should enjoy, frequently complaining of some of those physical symptoms like headaches, stomach aches, and chest pain, especially when it's always right before school. Repeatedly asking for insurance, like, are you sure I'm going to be okay, mommy? Are you sure that this is okay? Difficulty concentrating. So again, this is one that's a little bit hard to recognize in children and sometimes is under-recognized or misrecognized as something else. Easily getting frustrated with other tasks, so maybe getting angry or irritable. Engaging in repetitive behaviors like nail biting, skin picking, hair twirling, which all can be normal also. So it doesn't necessarily, just because your child nail bites or skin picks, it doesn't mean that they are anxious. But if they are doing it, you should look at it in the larger context of, are you seeing any of these other behaviors? If these signs are persistent and they interfere with your child's ability to enjoy their daily life, then we really should start talking about ways to explore supporting that child. So I want to take a pause here and say, well, these are all symptoms potentially of anxiety in an elementary school or school-age child. They do not make the diagnosis of anxiety. So if you fear or are worried that your child is exerting some of these symptoms and you think they might be anxious, you should absolutely bring them to your pediatrician and they should further evaluate them with standardized methods for scoring and diagnosing anxiety with things like the scared tool, etc. So let's move on to common sources of anxiety, or times when if a child is anxious, it might be exacerbated. So some common triggers are definitely school-related stress, changes from elementary school to middle school to high school, pressure from academics, so tests for sure, or social dynamics, like having somebody in your class that's new or being separated from your best friend in their next class. Family changes, moving, a new sibling, a family member becoming ill, moving houses, changing rooms. Social changes, making friends, worried about making friends, having somebody who's not being nice to you, like potential bullying or feeling left out. Big world events. So anything on the news that's talking about disasters, war, conflicts can be very overwhelming and stressful for a child. And then I kind of want to finish on a really common one that I see, which is perfectionism. Children who have high expectations of themselves can sometimes lead them to be stressed out. And while this can also be a strength, it can certainly lead to anxiety. So that might be a child that a parent wants to be kind of extra supportive of, helping them manage some of that stress. And every child is totally different. Some may be naturally more sensitive and cautious, while others more anxious due to past experiences. Maybe they got hurt when they did something. Maybe they saw something that another child didn't. And so let's kind of switch gears now and focus on how do we help our children and what are some practical ways to support them. So I always tell my patients anxiety is normal and it's common. Up to 20% of children experience some significant anxiety during their lifetime. And why do I say anxiety is normal? Because in certain situations, you should feel anxious. Like I always tell, especially little children, if something were chasing me, I would be anxious because in that situation, I should feel anxious that something is potentially dangerous, and that helps me get out of a dangerous situation. It's when anxiety interferes on a day-to-day aspect of our ability to either perform at school, to sustain and build friendships, to enjoy the activities that we usually enjoy. And we're really fortunate in that there are scientifically backed, evidence-based strategies to help children and help parents support their children and help them build resilience. So let's talk about some of those. One, validate their feelings, but don't reinforce their fear. So what do I mean by that? And what does the research say? So the research shows, and studies show, that acknowledging emotions without reinforcing fear helps children feel understood while also engaging them in coping skills. So what are some examples of that? What does it actually mean? So things like saying, I see that you're feeling nervous about school today. It's okay to feel that way. Avoid saying there's nothing to be afraid of. Instead, help them by problem solving. Ask things like, what's one small thing we can do to help you feel better? Teach kids to name their emotions. This can reduce the intensity of anxiety. It's a concept that's been studied. It's known as name it to tame it. So helping them say, I see that you're feeling, or I think that you're feeling afraid. I think that you're feeling nervous. It seems like you're feeling sad, to help reduce the intensity of that emotion. So gradual exposure. It is actually important to face, not avoid, anxiety triggers. The research shows avoidance of anxiety-inducing situations can actually reinforce that fear. And it is better to gradually expose a child to their fears in small steps. This is the basics behind something called cognitive behavioral therapy, or CBT, which is actually the gold standard for treating anxiety. So what are some examples of that? I like to use the common anxiety of speaking out loud in class. You want to set small, achievable goals for them. So maybe you can start with something like practicing at home, having them speak up at the dinner table with you, and then gradually raising their hand in class, and then maybe having them answer one question in class and moving on and keep building on that skill until maybe they're able to speak in front of the classroom. An important part of this is you want to praise their bravery and effort, not the outcome. So I'm proud of you for trying, even though it felt scary. You might want to create, if there are especially little ones, like a little bravery chart to help celebrate those small wins. Again, emphasizing the win as being the fact that they made the effort, not that they achieved an outcome. 3, teaching coping strategies. Calming tools work. Research shows, again, and supports things like breathing exercises, mindfulness, and relaxation. They help effectively calm an anxious brain. So what are some examples of that? Deep breathing exercises, so for small kids, teaching them to smell the flower and blow out the candle, helping them slow down their body's stress response. Progressive muscle relaxation, so relaxing and tensing muscle groups, like giving them a stress ball to squeeze and release. Mindfulness activities, having them listen to sounds, having them focus on breathing, having them practice staying in the moment. And lastly, movement-based strategies like stretching, jumping, fidget spinners are all ways that can help reduce nervous energy. For those younger school-age kids, setting up predictable routines. Research shows and studies indicate that consistent daily routines provide a sense of security and reduce anxiety for children and adults. So stick to a regular schedule for meals, homework, playtime, bedtime. Create a predictable environment. Give warnings between transitions. In 5 minutes, we're going to start going to bed. Like, for example, for a child who might have a fear of the dark. Use visual schedules, so pictures and lists to help your child understand what is expected next of them. 5, can't be underrated, modeling healthy ways to manage stress. Children learn how to cope with stress by watching their parent. There's tons of research that supports that. So modeling healthy coping mechanisms in yourself can help children to develop their own strategies. So try to actively show ways that you like to handle stress. So say things like, I had a stressful day. I'm going to take some deep breaths. Try to avoid catastrophizing situations. Help them focus on solutions instead of the problems. And model positive self-talk. Things like, you know what, this is hard, but I know I can handle it. To help them know that they can also handle it. 6, using physical activity and outdoor play. Again, there's tons of research to support exercise releases endorphins, which reduces our stress hormones and improves our mood. Studies show that things like outdoor time, yoga, and sports all help reduce anxiety symptoms. So try to get them to engage at least, depending on your child's age, ideally 60 minutes of movement daily. That can be things like just playing outside. It does not have to be structured movement. Going for a walk, riding their bike. Try family walks to, again, model that good behavior. Family yoga classes, nature play, time outdoors in general, even without structured play, just being outside has been shown in certain studies to lower stress in kids. Storytelling and books are great teaching mechanisms for children, and they can also be used to teach coping skills. It's called bibliotherapy, so using books to help children process emotions has been a research-proven effective management strategy for reducing anxiety. There are tons of books out there, but some that I recommend are things like What to Do When You Worry Too Much. It's a great workbook that's based on CBT for children. The Invisible String is a great book for children who are specifically dealing with separation anxiety. Hey Warrior explains really nicely to children what anxiety is in a way that they can understand it. And for younger kids, I like When My Worries Get Too Big. Great book. On top of these books helping teach children and make them in a way that they can understand what anxiety is and giving them some tools, it also helps them feel alone. It gives them characters who are facing similar fears to themselves to help them feel less alone and gives them tools to cope at the same time. So when to seek help? I would say right off the bat, if you have any concerns, you should seek help. But certainly if you feel that anxiety is interfering with your child on a day-to-day basis and their ability to go to school, enjoy the activities that they like, and make friends. So if you do choose to seek help and your child is diagnosed with anxiety, what can you expect? Research really supports the use of cognitive behavioral therapy, also called CBT, and parent coaching interventions for childhood anxiety. Professionals can help teach parents and children ways to cope. Some of these coping strategies we were talking about. And again, signs that professional help is likely needed if your child's avoiding school, friends, and activities due to anxiety, if they're frequently having stomach aches and headaches, shortness of breath, chest pain without any medical cause, certainly if they experience panic attack or having needing excessive reassurance or they're excessive reassurance seeking, or if it's interfering with their sleep. So just some closing thoughts. Anxiety is really common in children, but the good news is parents play a powerful role in helping their kids build confidence and resilience. Using evidence-based strategies like gradual exposure, coping tools, structured routines, you can really help your child manage their worries and develop lifelong emotional skills. If you have any strategies that work with your families, please feel free to share them in the comments below.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.